Okay, welcome back to slide 9, and this is a closer look at the major respiratory organs. And so I really want you to focus on all of the anatomy that you're seeing here and try to commit that to memory. So some of the things that you want to notice is that when you are tracing the flow of air coming into the trachea, you'll notice that it comes down the trachea and you'll see this fork in the road right here. And this is the site of carina. And on that site, it's going to branch to the right and left bronchi. And that will eventually branch into bronchioles, and it goes 25 layers of bronchioles to the bottom of each lung. And if you look real close, I'm going to zoom in here so you can see the lungs closer. There's a difference in the number of lobes between the right and the left lung. Can you see a difference? How many lobes do you count in the right? Yes, you can see right here. From the anterior view, 1, 2, 3. On this particular lung, on the patient's left, 1, 2. On our next slide, you get a chance to practice the different structures that we were just looking at and to match them up with the different functions and things that they do. I provided the answer choices here for you, but I hope that you'll take time to also work these out. It's not unusual to see a matching activity like that on a quiz or our next exam. Now we're going to look at functions of the nose, and basically it's, for respiration, but one of the cool things about it is that it will moisten and warm air that's coming into your schnoz, and it filters air through your nose hairs. And basically the way your voice sounds is because of your nose and the way it's structured. It's a resonating chamber for your speech. But something else that's kind of neat is that it does house all your olfactory receptors, aka smell. So the nose is divided physically on the exterior and from the anterior aspect into two regions. We have the root bridge and the dorsum nasi and the apex, and then the internal nasal cavities. And then this little dip that's on the outside of your nose, right underneath the nose, inferior, is the philtrum. And then you have your nostrils, now known as nares. We're not going to spend a lot of time with this external anatomy, so you really don't have to worry about this particular picture. But do notice the terms that I just mentioned, like philtrum, apex, dorsum nasi, and root, just to kind of get familiar with that. So when you look at your nasal cavity, it's got a midline nasal septum, and you may remember that there's two bones that form that nasal septum. Can you name them from level 1? If you said vomer and what else? Ethmoid, you're right, that forms the nasal septum. And the nose and the nasal cavity inside is opening to your nasal pharynx. And the bones surrounding that are ethmoid and sphenoid bones forming the roof of the nasal cavity. And the floor of the nasal cavity is formed by the hard and soft palates. You may remember us talking about the palatine bone in level 1. So your nasal cavity is also lined with the respiratory mucosa. So you've got nice soft tissue linings up there of epithelial tissue. And these also help secrete mucus. And mucus contains lysosomes, which is a type of secretion that helps destroy and ward off bad bacteria. So you do want to keep your nose a little on the moist side so that the mucus can circulate around. You don't want to get your head too dried out. You get it dried out, it gets sticky. It's almost like a post-it note. And bacteria can come in and just stick down and set up for infections like bad sinus infections that are hard to get rid of. And also you have a vestibule inside the main nasal cavity. And you may remember from level 1, vestibule is like a grand entranceway opening. And we also have nose hairs, and they're called vibrissae, and they actually serve a purpose, and that's to filter coarse particles from the air like pollens, grass debris, things like that. So this is a cadaver showing you a lateral cross-section, mid-sagittal, and you can see that this particular person had a couple of bad habits. Notice the teeth and the coloration and the inside nasal meatus. So we're going to pause right there and give you a chance to work on all of this particular anatomy. You need to know it.